Hi, I'm Dr. David Greene, CEO of Preferred Pain Center here in Phoenix and Scottsdale, Arizona. Today I'm at Packard Stadium, which is home to Arizona State University baseball and has been since 1974. 5. That's the amount of NCAA titles this program has produced in that time frame. Unbelievable. They produced close to 100 Major League Baseball players, including Dustin Pedroia, Barry Bonds, and a slew of others. It's a really top-notch program. The university is in the throes of signing a deal with the Chicago Cubs to move the program to a Mesa Stadium about 4 miles outside of the campus. And that would cost around $84 million, of which the university would pay $2 million. That's not bad. It's around 2% of the cost. Anyway, the topic for today are the myths of back pain. And I wrote down 5. I'm going to debunk all of them. So let's start at the top. First one I wrote down is head. A lot of people think that back pain is all in a person's head. Are you telling me that over 50 million Americans who suffer from back pain are simply playing head games and that they could just think about it and make it go away? The answer is that is absolutely ridiculous. We do know that there is a significant amount of psychological component to a person's pain, but there are reasons that people get back pain. Degenerative disc disease is a process that can affect people who are young or old and can cause significant back pain on a daily basis. Arthritis in the joints of the back, called the facet joints, can cause significant pain in a person. Or if they've been in a car accident, you can get injury to your low back and have legitimate reasons for suffering from low back pain other than it just being in your head. So that is ridiculous. And there are plenty of research studies to show that that is ridiculous. So number 2 on the list is cause. We are so focused in society of, I have a problem, get rid of it, get me back to doing the things that I want to do. In order to get rid of the problem in that step fashion, you would need to be able to determine the exact cause of it. Now, you can go to the best pain doctor out there. You can go to the best spine surgeon, pick your specialty, okay? Board certified, fellowship trained, double board certified, triple board certified. It doesn't matter the level of education that a person receives, because even the best of the best can only tell you why your back hurts 50% of the time. That's it. The rest of it is subjective. We don't know why a person hurts the other 50% of the time. You can theorize and think all day of, well, I think part of it's the facet joint, some of it's the muscle problem around the back, you know, the low back equivalent of whiplash, whatever the case may be. Only half the time can you give somebody a definitive diagnosis. So that debunks that myth. You know, if you have a friend who has a lot of back pain and you think, oh, why can't they tell you why it hurts? It's because we're not maybe sophisticated enough with modern medicine to be able to tell patients why they hurt so bad. So number 3 on the list, I put old or young, but the myth is that only old people get back pain. That's simply not true. Old people, and I use that term relatively, because basically take your age and add about 5 to 10, that's old, right? So let's just classify it into how these diagnoses bear out. If you're in your 20s, 30s, 40s, degenerative disc disease is a common source of back pain. And a lot of that goes down to genetics. Some of it comes down to repetitive micro trauma, like if you're a truck driver and you keep having a little bit of this as you drive for miles and miles, you know, years on end. Degenerative disc disease can be a big problem. But as you get to be an older individual, you know, 70s, 80s, the disc is very hard. I mean, you lose a lot of the water out of your disc and it's not so much of a problem. The problem then shifts more into an arthritis type of problem, and that's where the myth comes, is people think, oh, you have to have arthritis to have back pain. Well, young people get arthritis too. I got news for you. And it's not necessarily, you know, rheumatoid arthritis or psoriatic arthritis. Young people get osteoarthritis. And that may be post-traumatic, from a car accident. You may irritate the joints around the low back and have some arthritis form afterwards. So that's a myth that only old people get back pain. Number 4, surgery. The myth is that surgery will take away your back pain. That is a big myth. If anybody tells you that they're going to do surgery on you and get rid of all your pain, it just doesn't happen. That's called a home run. And people who hit home runs in this country are made into heroes because they don't happen that often. And if they do happen a lot, those guys make a lot of money and they go into the Hall of Fame. That doesn't happen with back pain. More realistic is that if you do a surgery for the right reason in somebody, you'll get rid of half of the back pain, maybe 70–80%. Now it's a little bit different in a disc herniation scenario, because there you can often get rid of 95% or more of a patient's back pain. I'm talking about degenerative disc disease, scoliosis, things like that. If you look at all of back surgery, typically it's probably 50–70% of a person's pain can you get rid of. And those are good, okay? So that is a myth that surgery gets rid of all of a person's back pain. Now, what's the last one on here? Narcotics. The myth is that narcotics are the answer to everybody's back pain. And that is just that. There's a big problem in this country with pill mills and the perception of pain management now that it revolves around narcotic treatment. Now that is a problem, but the vast majority of pain clinics in this country are not out to simply write prescriptions for every patient. There is a new treatment paradigm called comprehensive pain management that is permeating the field, and it incorporates physical therapy, chiropractic treatment, spinal decompression therapy, even yoga and other acupuncture types of alternative treatments that work. TENS units, spinal decompression can help, spinal cord stimulators can help, and all the different injections for pain management, such as facet blocks, radiofrequency ablation, and those types, to try and either decrease the amount of narcotics or eliminate their need altogether. So the vast majority of the profession is working towards lowering the amount of narcotics that a person needs as opposed to ramping up and up and up. So all back pain is not treated by narcotics, and it's not necessary. So there you have it, 5 myths debunked. There's a ton of information on our website at preferredpaincenter.com. If you would like an appointment to come in and see our doctors, it's 602-507-6550. First-time rehab patients receive a free massage, and the first treatment will get you in within 24 business hours, guaranteed, to our rehab center. Thanks. I'm Dr. David Greene, Preferred Pain Center. Your pain stops here.